We will continue our IVF series and we will discuss causes of male infertility. So we're on step 11 of male series. So step 11. Okay, so in couples with infertility, it appears that 25% of the cases, the male factor is responsible. And up to 50% of couples with infertility, we can detect some degree of male factor infertility. So in order to understand the causes of male factor infertility, let us review the reproduction process. So reproduction, the function of reproduction is a production of sperm, which is governed by regulation of the process by pituitary gland, then production of the sperm in the testis, and delivery of the sperm with vas difference in other reproductive tracts. So accordingly, the causes of male infertility is linked to disruption of one of these three levels of the production process. So if disruption is happening in the level of testis, we call it testicular. If disruption happens in the process before the testis, which means it's linked to the hormones which should stimulate the testis at the level of pituitary, we call it pre-testicular. If disruption is linked to the level after the production of the sperm, linked to the delivery of the sperm during intercourse, then we call post-testicular. So we can categorize causes of infertility into three: testicular, pre-testicular, and post-testicular. And all the causes of male factor infertility can be put into one of these three boxes. And the investigation and treatment also follows according to which level is causing the problem. Okay, now let us examine step by step. We will start with the pre-testicular problem, and all the causes of male infertility in this level is linked to the disruption of the work of the pituitary gland. This is a gland which is based on the base of the brain. So as we discussed previously, the main function of the pituitary gland is to produce FSH and LH hormone, which stimulates testes to produce testosterone and the sperm. So if you have a disruption here, then we have a disruption in the level of testes. So the most common problem we see in this level is use of anabolic steroids or testosterone, or protein shakes which contains testosterone for bodybuilding and other sports activities, which causes disruption or shutdown of the pituitary, and hence the level of FSH and LH drops, which means they cannot produce testosterone and sperm. So this is one problem. And the second is a severe chronic stress can cause disruption of production of FSH and LH. So this could be linked to severe chronic physical, mental stress, and being underweight or overweight. So the next problem, which is not very common, is a pituitary adenoma, where we have a growth, benign growth in the pituitary, which can cause a disruption of, again, production of FSH and LH. And the last cause is a genetic condition called Kalman syndrome. Due to a defect in the gene, the patients cannot produce FSH and LH hormone. So let us move on to the next level, testicular causes, which is very common cause of male infertility. Here, the factors which cause this problem directly impacts developing sperm. So sperm stem cells and sperm cells are very sensitive to different factors because they're actively dividing cells, and various environmental factors and various other factors can impact development of the sperm. So let us examine them one by one. So one category is the childhood diseases. Here we have two different type of disease conditions which can cause this problem. One is undescended testis, and second one is mumps virus. The reason undescended testis, if it's not treated early enough, can cause a testicular problem, is that the testis should develop, sperm and testicular tissue should develop in cooler environment in the scrotum. If in this condition undescended testis is located in abdomen or abdominal wall, where you have increased temperature which can cause damage to the testicle, irreversible damage to the testicular tissue. And mumps virus is also very damaging to the testicular tissue. So the next problem is in the level of genes. So there will be observed two common, not common conditions, but in this category, these are most common conditions. So one is called microdeletion of Y chromosome. Y chromosome has specific areas in it which is responsible for sperm development, sperm production. If in these patients you have a deletion or defect, absence of those regions, which can cause severe male factor infertility. And also having one extra X chromosome called Klinefelter syndrome can also cause this problem. Normal set of chromosomes in men, as you know, 46XY. In patients with the Klinefelter syndrome, they have one extra chromosome. These conditions are not very common, but in patients with severe isospermia, which means if they don't have any sperm, certainly we need to investigate for these causes. The next category is a treatment for cancer, like surgery for testicular cancer. Chemo and radiotherapy can be very damaging to testicular tissue. So, and environmental causes include industrial chemicals. Working in the environment with increased radiation or increased temperature can cause damaging effect to the testis and can affect the sperm production. And various lifestyle factors, have eating very unhealthy diet and for long term, and heavy smoking, alcohol, using recreational drugs, or doing very little physical exercise can also have a cause testicular reduction in testicular sperm production. So then reproductive causes, varicocele and testicular trauma, and some medications can cause male infertility due to a production problem. So next level is a post-testicular, which means in these patients, pituitary is working very well, stimulating testis. Testis is producing sperm. There are plenty of sperm in the testis, but in this category of patients, we have a failure of delivery of the sperm from testis to ejaculated semen. So, which means we have some kind of obstruction, obstacle for the delivery. So most common cause is obstructive, which means usually it happens in the level of epididymis or vas deferens, or it can even happen in the level of prostate or urethra. So we have obstruction. That's usually linked to infection, usually chlamydia or gonorrhea infection, or previous history of vasectomy. So the next category of problem in this level is genetic, and especially in the patients with cystic fibrosis, they may have absent vas deferens, which means this vas deferens, this tube may be absent, so which can result to azoospermia. So the next level is linked to sexual health, infrequency of intercourse or erectile dysfunction, and also the condition called retrograde ejaculation. In this condition, a man can ejaculate inside the bladder during the orgasm rather than outside. This is linked to the weakness in the nerve cells here in the base of the bladder, which is linked to diabetes or can be linked to the prostate surgery. Yes, we can see from this presentation, there are 3 levels of governance of process in male fertility, male reproduction. The level of regulation, we call it pre-testicular. The level of production, we call it testicular. And the level of delivery of the sperm, which is in the category of post-testicular. So it is very important to try and establish exact cause and exact category of the condition which is causing male infertility. and which we usually achieve by doing various investigations. In the next talk, we will discuss those investigations. Thanks for your time. I will catch you next time.